Dr. Luke Evans.
Deputy Speaker, most of the East Midlands is in Tier 3 due to the vast numbers of the cases in the second wave. Applying the 5 criteria to my constituency, we've had above national average rates in all ages. We've had above national average rates in the above 60s. Yet our rates have fallen significantly, our positive rates are falling. However, pressure on our local NHS is still high, with 30% above the COVID peak in cases in April, and a serious risk of further suspension and cancellation of non-COVID services. When I voted for the national lockdown, it was to protect the NHS nationally from being overloaded, and the same logic applies here locally. But my concerns are wider than that, and what happens in 2 weeks. My first concern is being coupled with Leicester. The second is the model applied at the 16th. Since the announcements of the tiers, I and my Leicestershire colleagues have argued for Leicestershire to be decoupled from the city. Now, this is not COVID NIMBYism, but an evidence-based approach. How can I be sure? Well, because Leicester and Leicestershire are living proof of a model that worked for us before. We did it all in the summer. If a blanket approach had been taken, then Hinckley and Bosworth would have been entering 154 days of higher lockdown measures like the city. It's unjustifiable then, and it will be unjustifiable now. So I've taken heart from the assurances I've received both privately and now from a letter from the Health Secretary stating we will again assess each area individually, including Leicestershire, on its own merits. And that leads me on to the second part, moving tiers. The PM, in his response to the Right Honourable Member for Tunbridge Wells today, said that he would be taking as granular approach as possible. And the Health Secretary, on the 1st of September, said to the Chamber, we are driven by the data. Taking these 2 points together, Hinckley and Bosworth have categorically proved that we, my community, can apply the rules and maintain a Tier 1 while neighbours are in Tier 3. This is unequivocal, real-world data for a borough-based model in Leicestershire. So my ask of the government is this. Let the people of Hinckley and Bosworth be the masters of their own destiny. Empower them to follow the rules and drive the rates and hospital admissions down. Give us the chance to again demonstrate, as we did in the summer, that we can control the virus. And in return, come the 16th, provide them with a lower tier, a reduction and a tried and tested borough-based system for Leicestershire so we can save lives and livelihoods.